Stop for 1 second and think about what you ate this morning. A banana in your cereal, maybe orange juice with breakfast, a baked potato with last night's dinner still sitting in the fridge. If any of that sounds familiar, I need you to keep watching because what I am about to tell you is not what most people expect. Every single one of those foods has been called healthy your entire life. Heart healthy. Doctor approved. The kind of food that shows up on every list of things seniors should eat more of. And for a lot of people, that is completely true. But for some seniors, especially those whose kidney function has already started to slow down, these same foods can quietly push potassium higher than it should be, and most people do not find out until a blood test comes back and their doctor asks a question they were not ready for. I'm Grace Wells, kidney and diabetes health educator for older adults, and today we are talking about potassium after 60 and 5 foods that are often assumed to be completely kidney safe. But depending on your kidney function and your lab results, they may be working against you without you ever noticing. Before we go any further, I want to be honest with you about something. This is not a video designed to scare you away from fruit or vegetables or make you feel guilty about breakfast. This is about understanding why potassium behaves differently in the body after 60, why kidney health after 60 changes how your system handles this one specific mineral, and most importantly, how to know if any of this even applies to you in the first place. Because here is the part almost nobody explains clearly enough. Potassium is not dangerous for everyone. For most people with healthy kidneys, potassium is simply a helpful, ordinary nutrient. The concern only shows up in a specific situation when kidney function has already declined, when someone has been diagnosed with chronic kidney disease, or when certain medications change how the body processes potassium. This does not mean panic. It means pay attention, and it means understanding your own numbers instead of guessing based on a headline. Stick with me because the last food on this list is the one that surprises almost everyone, including people who already think they eat carefully. A woman named Carol, 68 years old, told me something I have never forgotten. She said, "I thought I was doing everything right. Fruit with breakfast, vegetables with dinner, nothing fried, nothing processed." And then her doctor called after a routine blood test and told her that her potassium was higher than it should be. Carol said the strangest part was not the number itself. It was realizing that the foods she was most proud of eating were part of the reason why. That is exactly why this video exists. Not to frighten you, but to close a gap that almost nobody talks about. The gap between eating what looks healthy and eating what is actually right for your specific kidneys. So let's talk about why this even happens in the first place. Your kidneys have one very specific job when it comes to potassium. They filter the extra amount out of your bloodstream and send it out of the body through urine. When kidney function is strong, this entire process happens quietly in the background, and you never think about it the same way you never think about your heart beating. But as kidney function declines, even mildly, even before you notice any symptoms at all, that filtering process slows down. Potassium can start to build up in the blood instead of leaving the body the way it is supposed to. This is why potassium is never really a food problem on its own. It is a lab-based, kidney function-based issue. 2 people sitting at the exact same table, eating the exact same meal, can walk away with 2 completely different outcomes, depending on their eGFR, their creatinine levels, and whether a doctor has ever told them they have any stage of chronic kidney disease. So before we go through the list, remember this. If your doctor has never told you to watch your potassium, this video is not meant to alarm you. But if you have been told your kidney numbers are borderline, if you live with diabetes, high blood pressure, or you take certain medications, the next few minutes may matter more than you think. And the food at number 3 on this list is the one that catches even careful eaters completely off guard. The first food to notice is the banana. It has one of the best reputations of almost any fruit on the planet. Heart healthy, good for muscle cramps, gentle on the stomach, easy to grab on your way out the door. All of that can be true, and for many people it is. But a banana is also one of the higher potassium fruits you can eat, and for someone whose kidneys are already working harder than they used to, a daily banana habit, the kind built over years without ever thinking twice about it, can add up in a way that never shows up until a lab result forces the conversation. This is not about fear. This is about awareness. Many seniors eat a banana every single day, the same way they always have, without ever connecting it to a blood test months down the road. That connection is exactly what this video is here to make clear, one piece at a time. The second food is one that sits on almost every dinner table in the world in some form or another. The potato. Baked, mashed, roasted, it does not matter which way it lands on the plate. Potatoes are naturally high in potassium, and interestingly, boiling them in a large amount of water and discarding that water can reduce the potassium content somewhat. But most households do not cook potatoes that way, and a large baked potato with the skin left on can carry a significant potassium load for someone who needs to be careful. And here is the part that catches people off guard almost every time. It is rarely the fried food or the sugary food or the obviously unhealthy choice that turns out to be the surprise. It is often the food that looks the most wholesome, sitting right there on the plate, next to the vegetables everyone assumes are automatically safe. The third and fourth foods often travel together in people's minds because they share the same reputation. Tomatoes and oranges. Both are praised endlessly for their vitamins. Tomatoes for lycopene, oranges for vitamin C. Both are also assumed by most people to be automatically kidney-friendly, simply because they are fruits and vegetables are supposed to be the safe choice. But tomatoes, especially in concentrated forms like sauce, paste, or juice, can carry a meaningful amount of potassium. And oranges, along with orange juice, sit in a very similar category. This is exactly why we say kidney health after 60 can be affected by everyday foods, especially when sodium, phosphorus, potassium, diabetes, or blood pressure are already part of the picture. It is almost never one single food eaten one single time. It is the pattern, repeated quietly, day after day, month after month, that a doctor or a renal dietitian is specifically trained to notice, long before you would ever notice it yourself. Now for the fifth one, the one that genuinely surprises almost everyone I talk to. Avocado. Over the last several years, avocado has become something close to a symbol of healthy eating. Heart-healthy fats, fiber, a favorite among nutritionists for general wellness, the food that seems to appear on every healthy eating list published anywhere. And for someone with normal, healthy kidney function, that reputation is well earned and there is nothing wrong with enjoying it. But avocado is also unusually high in potassium, higher than most people ever realize, and for someone managing chronic kidney disease, or someone whose doctor has already asked them to watch potassium closely, a food marketed as one of the healthiest options on the planet can actually work directly against the specific goal their doctor has given them. The front of the conversation says healthy. The kidney concern is usually the part nobody puts on the label, the part you only discover after the fact. This is exactly why we keep coming back to one central idea on this channel over and over, because it matters more than any single food on any single list. There is no universal list of good foods and bad foods when it comes to potassium and kidney health. What matters is your own kidney function, your own lab numbers, and your own doctor's specific guidance for you. A food that is completely fine for one senior may need to be limited for another, even if they are the exact same age, eating the exact same meal, sitting at the exact same table. So how would you even know if any of this applies to you? This is where blood tests become so important and where so many seniors tell me almost the exact same story, word for word. They felt fine, they looked fine, nothing seemed different in their day-to-day life. and then a routine blood test showed their potassium was higher than expected, alongside changes in creatinine or eGFR, and that single result was the moment the real conversation with their doctor finally started, sometimes for the very first time in years. Your eGFR gives your doctor a picture of how well your kidneys are filtering overall. Creatinine is a waste product your kidneys are supposed to clear from your blood, and rising creatinine can be one of the earliest signs that filtering is not happening as efficiently as it used to. Potassium levels, checked through a simple blood test, tell your doctor whether your body is holding on to more of this mineral than it should be. None of these numbers tell the whole story by themselves, standing alone. Together, side by side, they help your doctor understand what your kidneys actually need from you right now, rather than what a general article on the internet assumes about every senior in the same broad category. This also connects to something we do not talk about nearly enough. Diabetes and high blood pressure are two of the biggest risk factors for reduced kidney function over time, and if you are managing either one of these conditions, your relationship with potassium may look completely different than someone without them. Certain medications, including some common blood pressure medications, can also affect how your body handles potassium, sometimes in ways that surprise even the person taking them for years. This is exactly why we never say cut this food out completely on your own without a conversation first. Changes like this should come from your own results, discussed with your own doctor, not from a video, no matter how carefully researched that video happens to be. If any part of this is making you think about your own last blood test or a conversation your doctor already tried to start with you and you were not quite sure how seriously to take it, that reaction is worth listening to, not brushing aside. So what should you actually do with everything we have talked about today? Not panic, not throw away every banana in the house or swear off tomatoes forever. Bring a short, specific list of questions to your next appointment or your next blood test review and watch how differently that conversation goes. Ask your doctor or your renal dietitian, based on my current kidney function, are there any foods I should be mindful of right now? Ask whether your current potassium level is actually in a healthy range for you specifically, not for seniors in general. Ask whether any of your current medications interact with potassium levels in a way you should know about. And ask how often your kidney function should realistically be monitored going forward, based on your own personal health history, not a generic yearly checkup schedule. These 4 questions take less than 2 minutes to ask out loud, and they can completely change how confidently you walk out of that appointment instead of nodding along and hoping everything is fine. If this made you think of something sitting in your own kitchen right now, a banana on the counter, a bag of potatoes in the pantry, an avocado slowly ripening by the window, that reaction is exactly why I make these videos. It is not about guilt, and it was never about guilt. It is about awareness, the specific kind that helps you ask a sharper, more useful question the next time you sit across from your doctor. And if you have your own experience with potassium, whether it was a surprise on a blood test, a conversation with a dietitian that changed how you eat, or even a food on this list you never expected to see here, I would genuinely like to know. Type the word potassium in the comments below and share what surprised you the most about today's video. Your comment may help another senior watching this right now realize they are not the only one dealing with this exact same question, alone, at their own kitchen table. Before we close, one honest reminder, because it matters more than anything else in this video. This content is meant for education, not diagnosis or treatment. Potassium needs can vary enormously depending on your kidney function, your CKD stage if you have one, your medications, and your overall health picture as a whole. Please do not change your diet in a major way, and please do not stop or adjust any medication without speaking to your doctor or a renal dietitian first. What is true for one senior's kidneys is not automatically true for yours, no matter how similar your lives may look from the outside. If this is the kind of clear, honest, straightforward kidney health guidance you wish someone had explained to you years ago, This channel was built exactly for that reason, and for people exactly like you. Every week, we break down real questions about kidney health after 60 in plain, simple language, without the fear and without the confusion that usually comes with medical information. And if potassium was today's topic, sleep may very well be tomorrow's. Because there is a kidney-related warning sign hiding inside poor sleep after 60 that almost nobody talks about. One that is far more connected to your kidneys than most people would ever guess. If you have been waking up tired lately, wondering why, you will want to see that one. I will see you there.